right, a warm welcome to you from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation, and today it is Maria Manzan who's my co-host. Maria, how are you doing? I believe, how is the weather in Argentina?
Hi, Rita. Well, greetings from Corrientes, Argentina. It's a stormy day, but we're starting our summer soon, so still pretty hot. I'm very happy to be here.
All right, thank you very much indeed. We're just counting down the final minute until we kick off this event. We can go to the, let's have a look in the lobby. So for those of you who are watching the live stream, let me just show you how it works. This is a brand new platform for the Geneva Learning Foundation and for Teach to Reach. So in order to be able to join the event, you do need to reserve a spot. You can see only 199 people have actually done it. So many of you are still watching in the lobby, which is fine, but that it also means you will not be able to participate, which would be much to our dismay. Now, we have a session following up on last Thursday's Teach to Reach, and here we go. Right, a warm welcome to you from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation. Want to warmly welcome you to this special session. Something new that we're trying for the first time is to connect data and people, and the data specifically from the Lancet Countdown, an ongoing research effort. We're going to hear from Dr. Marina Romanello about this ongoing effort and the latest annual report and its findings. But we're also going to hear and be listening to your voices, your stories, and we're going to see how, if and how, we can connect people with data today. I'm here with Maria Fernanda Manzan. Great to have you as co-host, Maria. How are you doing?
Thank you, Rita. I'm very happy to be here and looking forward to our session today.
All right, and we just are coming. We're a few days after the last Thursday, Teach to Reach 11, really focusing. One of the major themes was on the front lines of climate change and health, with many stories shared. For those of you who are with us in the Zoom studio, to request to speak, you'll need to use the raise hand icon. If you are watching on social media, in that case, you simply need to make comments. In the comments, there is a slight delay, but we'll do our best to keep up. A very simple sequence today. 1, 2, 3 is presentation, dialogue, and experiences. That means we'll be hearing from Marina Romanello of the Lancet Countdown. Then we'll be kicking off really the dialogue that will include experiences, the questions you may have about the latest findings of the Lancet Countdown on climate change and health. If you have poor connectivity today, don't worry, you'll be fine. And we do have a podcast that you can subscribe to. Download the content as audio only. So this is where we kick off with the first question, and I'm going to go to Lynn Eminari. Lynn, would love to hear from you. Don't forget to introduce yourself. And the question is the following: when was the first time that you realized climate change was affecting your community's health? What made this moment stand out for you? But first, do introduce yourself.
Hi, Reda. Hi, everyone. I'm Lynn Minari. I'm a researcher, and I work with child care and human development all the way here in the Philippines. So, as I said before, Rita, and then for probably those that were not here, I first realized that we are having and combating quite a change and climate change over here in the Philippines. And it was noticed, and we all came together to notice that it was about 3 years ago. There about the weather. We were having, normally November, December, we usually have rains, but not this heavy, not this intense. And it's been so dangerous with the typhoons running around. And then the rains were to come quite late in the middle of the year. But unfortunately, the rains came quite early than the normal time within the year, and lasted, and is still lasting up until now. So yeah, it's really been intense, and that's when we realized that we are having a climate change and a very intense difference here. Over to you, Reda.
Thanks, Lynn. So my next question for you is actually, what is one question that you have about climate change and health, and why does this question matter to you?
Awesome. Absolutely. Thank you so much for the opportunity. It's been really on my mind to ask the question why and how can we find a way around combating and helping, especially we over here that are experiencing a very strong intensity with the climate change and with the typhoons and the flood as well. And what suggestions can be offered, on how maybe predicting the future, predicting the incoming typhoons, and maybe how to be much more prepared, and what else can be done to help our community over here for the lives that has been lost, and ahead of time to prepare. Majorly, the preparedness is what I'm really, really interested in.
Thank you very much indeed. Lynn, let's now go to, I believe we were going to try Tafaroder, who I know was having issues with her connectivity. Tafaroder, do introduce yourself. You stand out, of course, as a leader in the Teach to Reach community. I believe you are the current record holder of the most Teach to Reach questions answered. So sharing your experience is something that you do. We're asking you these two questions today. When was the first time you realized climate change was affecting your community's health? And then what is one question that you'd like to put on the table for Dr. Marina Romanello's consideration? But first, do tell us who you are and what you do to work for health.
Hello, good evening, Reda and Dr. Maria Monzon, for having given me this opportunity today. I'm very happy to be one of the participants on this platform. How I come to know that there is a problem in my community is when we had very much rain in my country, especially this year. So many people were displaced, and after being displaced, they lost their belongings, and after that, they were taken to a place where there were no rooms for them to stay. There were open places. So I came to realize that these people are getting sick every time and then. And there were no medicine in the facility. So I came to realize that there was a big problem in my community. And what I did, I was just talking to them, taking some of them who were badly off to the facility to be given first aid. That is what I did.
Thank you very much indeed, Tafaroder. And what question would you have for Dr. Marina Romanello today about climate change and its impacts on health?
My question is, how are we going to work together to make sure these people are no more having these problems? Because in my community there are poor drainage. So when it rains, much water goes into the people's houses. They carry their belongings. Some even lost their lives. So what are we going to do to make sure they don't get these problems in future? Or how are we going to help them to get first aid if there is an urgent need? That's what I'm asking. And when they go to those places, they don't have even food, they don't have clothes. What are we going to do to help them? Thank you, Reda.
Thank you, Tafaroder. Over to Gifty Akosua Adzigbe from Ghana. Gifty, a warm welcome to you. Remind us who you are and what you do, where and how you work for health. And then if you'd like to share briefly, that's that moment when you realized climate change was affecting the health of your community, and what is one question that you'd like to ask Dr. Romanello today?
All right. Thank you. Hello, everyone. Thank you for the opportunity, Dr. Rida and the team. I'm Gifty Akosua Adzigbe, a public health nurse and also a disability health advocate from Ghana. First of all, I will say that I said it earlier on that climate change has been with us, just that it wasn't that severe as we see it now. So, but for me, for about 5 years looking at the trend, I realized that things are just maybe deteriorating even as compared to the earlier years. So here we realize that the weather becomes so dry when it's very sunny. I mean, bringing a lot of health conditions like the upper respiratory tract infection, where everybody is coughing. And so both children, both adults, and then everybody's just going through that. And when it is raining too, it becomes so severe that even where we don't even experience floods, we are now seeing floods. Even in our small gardens, we don't even have them again because all vegetables are gone. So there I realized that it's having more impact on even we, the health workers, and people we are attending to in the community. So realize that these pregnant women don't have vegetables to even feed on again when they come for antenatal care, and then we are educating them on the 4-star diet where they have their protein meals, their vegetables, and the other things. I mean, all from the 4 groups. Realize that they are not going to get these vegetables anywhere because they don't have them. The place has become so dry, nothing is there. And if it is the flood too, it takes everything away. So there we just have to work harder as a team. Although we are also affected, maybe we the health workers, we are already psychologically maybe challenged because now we are confused. We didn't even know what to do again. But with the help of what we're learning from the climb, from Geneva Learning Foundation, I realized that I had a stronger team. I could speak with my other colleagues through communication. I mean, how we meet on the line, and then we were able to build a stronger team. I was able to help my people in the community, especially those with special needs, talking about the people with disability. So we're able to educate them. They know about the condition and how they could help themselves by wearing masks, by washing hands. I mean, doing the basic thing that they could help them in the community. So today, I also want to find out from Dr. Maria and the team what I know we are doing a lot of things to help improve with the climate change and health. And I'm saying, we are also being affected because we are also health workers, and we are sometimes also overwhelmed with what we see in the community. So what can we do, especially for people with disability, when it comes to climate change and health? Thank you.
Thank you very much indeed. All right, this is a special session of Teach to Reach 11 on the 13th of December, and we are connecting with, for the very first time, Dr. Marina Romanello. Before we introduce her, she's here with us in our studio. Going to ask Maria Monzon, my co-host today, to share with us this first quote that comes from the COP29 special report on climate change and health from the World Health Organization.
Thank you, Rita. As trusted members of society, health and care workers are uniquely positioned to raise awareness about the health impacts of climate change, ensure evidence-based decision-making, and champion sustainable policies within their workplaces, in the broader community, and among policymakers.
Thanks, Maria. Next one is the following, and this is actually from the 2024 report of the Lancet Countdown.
Health workers are already intimate witnesses to the impacts of climate change on the health of the communities they serve, possessing valuable knowledge that should inform both science and policy.
And the third and last quote that we'll hear from you is actually from Charlotte Mbu of the Geneva Learning Foundation, and this was at the COP28 Health Pavilion, where she was speaking with her experience as a frontline subnational health worker.
What we know because we are here every day. And we know that climate change is a threat to the health of the communities we serve. We are already having to manage the impacts of climate change on health. We are doing the best that we can, but we need your support.
Thank you, Maria. And now we turn to our guest, Marina Romanello from the Lancet Countdown. A warm welcome to you. You've just heard a series of just a few of the voices of the stories that have been shared, that are being shared through Teach to Reach. Could I ask you first to introduce yourself, explain who you are and how you work for health, and then to respond and just what does this make you feel before we talk about the research and the data?
Thank you so much, Rita, and thank you so much for having me here. As you just heard, I'm the executive director for a big international research collaboration called the Lancet Countdown on Health and Climate Change. And we are a research collaboration We work on data. We work to produce evidence, generally scientific, numeric evidence on the links between health and climate change. So we work a lot with numbers to expose these links and the benefits that could come with climate action. And I was just listening to the testimonies, to the questions, and it's just so moving to hear the actual human stories behind much of what our numbers are showing us, to hear how it's affecting people today on the ground, and to hear the enormous amount of work and energy that is being put by frontline health workers as well in the most affected regions. So I'm so glad to be here, and thank you so much for this invitation.
Thank you very much indeed. So we're going to kick off now with your presentation. There's one technical issue which prevents us from allowing you to share your screen. So we have done our best to preserve your slides, and hopefully you'll let us know if there's anything out of whack. That sometimes happens, and we apologize ahead of time if that turns out to be the case. And for everyone in our Zoom studio is watching on social media, there's over 330 people on LinkedIn. I haven't checked YouTube or the other platforms, but we are reading your comments and your questions. If you're in our Zoom studio, you also have the Q&A feature as you listen to Dr. Marina Romanello's presentation. Over to you.
Excellent. Well, thank you so much again for having me here. And what I'm going to do now is I'm going to show you some of the latest findings of the 2024 report of the Lancet Countdown that we published very recently. And if you can go to the next slide, you'll see there what these reports look like. We published these reports as a collaboration of globally over 300 researchers around the world. And we produce these global and regional reports of the intersection between climate change and health. We have regional centers that we've started opening in some of the world's most affected areas, as well as some of the world's most polluting areas. And we're actually now opening a center in Africa. So there's an open call for a director for that African center that I really encourage you to look at and to share. But today I'm going to focus on our global work, on our global findings that are captured within these reports that you see on screen. The latest one, the 2024 report that we published ahead of the COP29. There was a crucial COP discussing finance and how the world would mobilize the financial resources to support the most affected countries by climate change. And this report is the product of 122 researchers from around the world, coming from over 50 institutions and developed in very close collaboration with the WHO. So if you go to the next slide, the most striking finding of this report, the one that shows most prominently, comes from the growing impacts of climate change on health. And as you can see on screen, we have about 15 indicators, single bits of numeric data monitoring in time the evolving impacts of climate change on health and on people's well-being. And of these 15 indicators, we see that 10 have reached a record high level of impacts, hazard, threats, or exposures in the most recent year of data. And in that heat map that you see on screen, what you're seeing is each of those indicators graphed with colors going from blue being the safest conditions in our monitoring timeline to red being the most dangerous conditions for health in the monitoring timeline. And as you can see, that very clear gradient in time towards more dangerous conditions. So we see record high impacts across most of our indicators that are disproportionately affecting the world's most vulnerable communities, both in the poorest country, the most vulnerable countries, but also in the wealthiest countries. It's even in wealthy, rich countries, we see that climate change is strongly affecting vulnerable populations. So next slide, please. The first thing that I wanted to share with you comes from the kind of perhaps most direct impact of climate change on health that has to do with the growing heat exposure. I've been hearing some of the testimonials that you have been sharing even before this call about how temperatures have become unmanageable, particularly for elderly citizens, for people that are living in areas without access to cooling, and the huge effect that has on their physical and mental health. So what we're monitoring here is just a very small percentage of that impact of heat on health. We're seeing heat-related death of adults over 65 years of age that we know are a disproportionately vulnerable age group with elderly populations being less capable of controlling their body temperature, of cooling, and therefore at very high risk from heat stress and heat stroke that is potentially lethal. And we see that the mortality attributed to heat of adults over 65 years of age has increased by 167% since the 90s. You can see that graph with a very steep growth. And this has been driven mostly because of the rising temperatures. Obviously, there has been an influence of a growing elderly population globally. But as you can see there on the screen, we would only have expected a 65% increase if temperatures hadn't changed. So we know that this huge growth in heat-related mortality is mostly due to the higher temperatures that we're experiencing. And we also know that this is just a very small tip of the iceberg. Death is the most extreme impact, obviously, of heat exposure. But in addition to mortality, heat is leading to a very high impact in terms of morbidity, in terms of disease, exacerbating underlying chronic health conditions like lung disease, heart disease, kidney disease. It affects pregnant people. It affects birth outcomes. It also affects very young children. And the morbidity also translates to reducing people's capacity to exercise outdoors. Obviously, when it's very hot, people that exercise are at acute risk of heat stroke, even people that are relatively healthy. And it also limits people's capacity to work outdoors. So in association with what you see on screen, heat-related mortality, we also monitor the loss of hours due to heat exposure. And we're seeing that that loss of hours of labor is growing globally with disproportionate impact in the most vulnerable countries where you have a very big workforce that depends on agricultural work, with agricultural workers having very limited capacity to protect themselves from the heat, being very exposed to the elements, doing physical work. And we see that the loss of labor capacity in those sectors has led in the countries with lowest human development index to a loss of income equivalent to about 7% of the total country's GDPs in 2023. That translates with people having less income, deterioration of their livelihoods, and obviously all the impacts that has on health and on well-being when people are struggling economically and on their labor sector. So the impacts of heat are broad, and they have many different layers in terms of physical and mental health too. Next slide, please. What we're also seeing is with climate change, not only temperatures growing, but also a change in precipitation and humidity patterns. And this happens both in terms of extreme precipitation and of extreme drought. So as you can see on screen, and again, this was something that was just being mentioned in terms of the lived experience of frontline workers on people suffering extreme precipitation and flooding. We see that over the last decade, over 60% of the global land area saw an increase in those days of very extreme rainfall, those flash rainfalls that lead to an increased risk of floods, of landslides, and that can affect also the physical infrastructure that health depends on. We've seen devastating floods in the past couple of years, including in Africa, but also in places like Europe, like South America. We've seen this huge impact of extreme floods because of extreme rainfall events and because of frail infrastructure. Clear examples, what happened in Brazil last year when a dam broke and a whole city got flooded as a result. So these events are becoming more frequent. And at the same time, we're seeing that we see dry spells becoming more frequent, more intense, and more lengthy. So we've seen that almost 50% of all of the global land area was affected by at least 1 month of extreme drought in 2023, up from an average of 15% in the 50s. That's a huge increase. And in the map that I'm showing you there, that shows the change in the number of months in extreme drought as compared to the 50s. So again, we're seeing very vulnerable parts of the world, like South America, even parts of the Amazon, parts of the North and South of Africa, Southeast Asia, suffering these very long periods of extreme drought. And that obviously will affect crop productivity, will affect food security, will affect sanitation, access to safe drinking water. It will affect also the livelihoods of people depending on transport on rivers. And it has even led to the isolation of whole communities in the Amazon as a result of low river flows. And these two events coexist, right? So we can have very long periods of extreme drought that are in the middle of an extreme drought spell, we see this flash rainfall that generates devastation as well. So this the loss of equilibrium of the hydrological cycle having very profound effects. Next slide, please. And with this changing temperatures and changing precipitation patterns, what we're seeing is that food security is being affected by many different ways. We see that crop productivity is affected, particularly for smallholders, for subsistence agriculture, for people without access to technology, which generally helps increase crops globally. So people dependent on very local production of food are being affected. By affecting people's livelihoods, also access to food gets affected. Climate change can disrupt supply chains, as we've seen repeatedly over the past few years. And all of that leads to an increase in the food insecurity that is due to heat wave and drought events. We're seeing 151 million more people experiencing moderate or severe food insecurity in the 124 countries that we've analyzed, that is directly associated with an increase in heat wave and drought events. So those are some, obviously, will have huge impacts on the health of people if it leads to malnutrition, disproportionately affecting children, on which undernutrition and malnutrition can have permanent effects on their health and well-being. Next slide, please. And the other thing that we're seeing that is very worrisome is an increased likelihood of the transmission of very dangerous infectious diseases. I'm showing you here two examples of them. A vector-borne disease, a disease transmitted by mosquitoes like dengue, where we're seeing that the environmental suitability for the transmission of dengue is increasing globally, has risen by 46.3% since the 1950 by Aedes albopictus, and by 11% for the transmission by Aedes aegypti. And we are seeing dengue spreading more to southern locations, to places where we didn't see dengue before. A clear example being here in Argentina, where I'm from, where Marie is from as well, that we're seeing these record dengue outbreaks linked to the unusually warm and humid conditions. And we're also seeing an increase in the likelihood of transmission of very dangerous bacteria like Vibrio bacteria through coastal waters. And we're seeing a record number of cases of vibriosis in 2023. These cases being, we're not measuring directly cholera, but we are measuring other vibrio diseases like flesh-eating bacteria, those bacteria that lead to gastrointestinal infections, and that can be very dangerous, life-threatening infections. Next slide, please. So with all of this, obviously, we need to strengthen our health systems to be able to cope with these growing threats. The health systems are the first line of defense, and healthcare workers are there at the front line of the health impacts of climate change. And for this, what we need is good capacity building in our health workers, good awareness building in the community of how to avoid being exposed to the threats of climate change. We need resources to support the adaptation measures in the healthcare system. And in particular, I'm showing you here two examples of what is very urgently needed, that is for health systems to assess their vulnerabilities to climate change, the risk that they're facing to climate change, and as a result, to develop the national adaptation plans to plan how they're going to protect local populations from heat exposure. And as you can see there on screen, we're still seeing very few countries that have undertaking the vulnerability and adaptation assessments and that have developed their adaptation plans globally. In 2023, only 50 countries had done the vulnerability and adaptation assessments, and only 43 the national adaptation plans, although driven by the WHO's ATTACH, there's the Alliance of Transformative Action on Climate and Health, that has brought together countries to come to COP, that has brought together countries to address climate change. We've seen a very big increase since 2022. So there's positive trends here. We're seeing more and more healthcare workers that are engaging. We're seeing more health systems that are preparing to cope with climate change, but still we're nowhere near the level of adaptation that we need to be able to avoid the worst impacts of climate change. And there's another slide that I had added last minute, but I'm going to just talk through it. That is the extent to which countries have implemented their their international health regulations and the capacities to cope with international health emergencies, which include outbreaks from deadly infectious diseases. And what is interesting there is that we see that it's the most vulnerable countries with low human development index and medium human development index, that are lagging the most in the implementation of the international health regulation capacities for health emergency management. And this is largely when we ask why countries are lagging in the adoption of these interventions, of adaptation interventions. What we hear the most is that it's because of a lack of financial resources, it's too expensive, or a lack of technical capacity. And that goes back to the importance of providing finance for adequate adaptation, which is what was at the heart of the COP climate negotiation that just happened, and which led to a very disappointing outcome, with the most vulnerable countries having requested something like 1.2 trillion US dollars per year for supporting their climate actions, and only having achieved an actual commitment of 300 billion with a laxer commitment of 1.2 trillion. So we're still not preparing to protect people from the health impacts of climate change, and we're still lagging quite a lot on that front. So on top of that, what we are seeing is that governments and companies are not only not acting fast enough to tackle climate change and to avoid a disproportionate growth in these health risks, but are continuing to increase the risks that we're facing, fueling the fire. So if we can go to the next slide, one of the most notable aspects of climate change, and one of the biggest contributors to climate change, is obviously the energy system. And what we see with very big concern is that the world's energy system is continuing to increase its emissions. We see that global carbon dioxide emissions from the energy system reached an all-time record high in 2023, 1.1% above the year before, and that we're not managing to displace fossil fuels from our energy sector. So we're still increasing the concentration of greenhouse gases in the atmosphere, worsening the outlook for people in every country and the health threats that we will be facing. Next slide, please. And this also has a very direct link with health, because it's not only about decarbonizing our energy system, but it's also about delivering energy in a much more sustainable way, and in a way that can be accessed by local communities. To give you an idea, we have data that says that about 1 billion people globally, this data developed by the WHO, 1 billion people globally are still served by healthcare facilities that don't have reliable access to energy. You will have much better stories about this than I do, or much more meaningful stories about this than I do. But we have heard from healthcare workers in underserved settings saying how women have to deliver in the dark, how they don't have energy to develop life-saving medical interventions because they don't have reliable energy in their hospitals, in their local clinics, in their local care facilities. And about 800 million or 700 million people globally still don't have access to clean energy in their homes, still suffer from energy poverty. And why this is important and linked to climate change? Because we could be providing low carbon renewable energy access by renewable energies that don't require a big grid infrastructure, don't require access to the central energy grid, to local communities, to off-grid communities, to remote places at very low price, if that is done right and with good technology transfer and with good financial support. But that is not happening, and not nearly at the pace needed. And what that means for health is that we see, as you see in the graph there that you have on the left, 2.4 billion people still use dirty fuels and inefficient technologies in their homes for cooking. And if you look at countries with different level of human development index, it's the poorest countries, those with the lowest level of human development index, that still meet 92% of the energy needs from biofuels, meaning that they're burning dung, they're burning waste, they're burning biomass and wood inside their homes to meet their energy needs. That leads to enormous levels of air pollution, people breathing toxic air. It also leads to, generally it is women and children that have to go and source the fuel, keeping them away from education, keeping them away from employment. And obviously energy and good energy access is essential for health, is essential for development. So this is a sign of energy poverty that has huge health ramifications. And we could be providing clean, renewable energy to these communities. What we see that is happening as a result of that persistent use of dirty fuels is that people are breathing toxic air. And again, the most extreme result, we see 2.3 million deaths across 65 countries alone in 2020 because of the use of dirty fuels inside people's home, particularly the burning of solid household fuels. 2.3 million avoidable total deaths. And this is only the deaths. We know that behind all these deaths is an exacerbation of respiratory conditions, of the respiratory disease, of asthma, of acute lung infections as well. So people are breathing toxic air, which could be avoided by providing renewable energy whilst tackling climate change. Next slide, please. A bit of a good news there. We have seen some improvements, particularly when it comes to outdoor air pollution. The deaths from fossil fuel-derived air pollution have fallen almost 7% from outdoor air pollution since 2016. They're still quite high, though. We still see over 2 million deaths due to outdoor air pollution coming from fossil fuels. But the good thing is that by reducing coal burning and coal-related air pollution, we have managed to save thousands of deaths globally, showing how impactful it can be to phase out fossil fuels, to transition to clean energies, how many lives and burden of disease we could be avoiding by clean energy access. Next slide, please. So the last one that I did want to share with you on this front is some of what tells us about the causes of this and why we're seeing this problem and the consequence that it's having to many countries. So as you will have probably seen, heard of, or even experienced after, like in the last year, particularly after the war in Ukraine, what we've seen is that the energy prices have spiked, have grown quite a lot. And what that had to do is with a growth in the prices of fossil fuels globally, fossil fuels being international markets with prices internationally determined and generally very volatile. Most of countries still very strongly rely on the use of fossil fuels to meet their energy needs, as we've discussed before. Our energy grids are still highly reliant on fossil fuel burning. And as a result of that, countries had to respond to the spike in fossil fuel energy prices by increasing their subsidies to fossil fuels to continue to make energy affordable and avoid an increase in energy poverty. So that meant that countries had almost no choice but to allocate trillions of US dollars to make energy affordable because we still depend so heavily on fossil fuels. The shocking figure here is that in 2022, 84% of the countries that we've analyzed were still subsidizing fossil fuels, allocating a record net total of 1.4 trillion US dollars. And this is quite striking under the backdrop that during the last COP, we only committed 300 billion to supporting climate action in the most affected countries. But we have no problem in finding 1.4 trillion to subsidize fossil fuels, which is affecting our health, which is killing our populations. These subsidies exceeded 10% of all of the national health spending in 55% of countries. And almost 30% of the countries that we've analyzed allocated more funding to fossil fuel subsidies than to their whole total health system. So that tells us quite a lot about where priorities are and talks very loudly about why we're seeing that financial constraints are still limiting our capacity to adapt and to protect people from the impacts of climate change. Next slide, please. So we have a very critical role to play as healthcare workers, particularly frontline healthcare workers are so powerful. Firstly, you are in the first line of defense against the health impacts of climate change. You see these impacts, not in numbers, but in people's impact, in human impacts. And as such, you can raise alarms, you can raise awareness of how climate change is affecting local communities. You can identify where adaptation efforts are most acutely needed. And you can increase knowledge and awareness of local communities, both in terms of the growing health impacts of climate change and of the opportunities and the need to change your behavior, to protect yourselves as much as possible, and to demand governmental policies, robust governmental, national, and international action on climate change. That awareness raising is essential for action to happen. We as healthcare professionals, health systems, public health professionals, can also contribute quite a lot to decarbonization by more stringent air quality control measures, by supporting the transition to healthier low-carbon diets, by transitioning to more sustainable livelihoods that promote better physical and mental health. The health system, and this is something particularly important for high-income countries, contribute quite a lot to greenhouse gas emissions as well. We contribute to about 10% of all global greenhouse gas emissions, which means that we have a lot of control over the problem. And we also control we manage about 5% of greenhouse gas emissions. I think I said that wrong. But we also control about 5% of the global GDP, which means that we can have a huge influence on the global economy. And finally, we can also help shape all climate policies to ensure that they're not just protecting the environment, which is very important, that they're not just protecting the infrastructure, which is very important, not just protecting the economy, but protecting all of those for the benefit of people's health and well-being, keeping people at the center, ensuring that we're minimizing and avoiding any unintentional harms, that we're maximize people's health, people's well-being, and that we're transitioning to a future that actually sustains better lives. So just with the next slide, to thank you for your attention and invite you, if you want to find out more, to visit lancetcountdown.org. And I really have to acknowledge both the Lancet and Wellcome for the funding and for the enormous support that they give us every year. And very looking forward to this discussion.
Thank you very much indeed. Dr. Marina B. Romanello is our guest today for this special session of Teach to Reach 11, connecting the Teach to Reach community with the data and insights and findings of the latest Lancet Countdown. So we have questions have been accumulating. Let me see. So we have, and we're going to be able to, we should be able to show them on screen. So actually this was, a couple of the questions came before your presentation. So maybe we can just start there. One of them was from the first Teach to Reach leaders who shared their experiences. One wanted to know about predicting extreme weather events. And there's another question about how we are going to work together. What are you able to share from the Lancet Countdown, but also from your broader engagement as a researcher and stakeholder in this? What's at stake with climate change and health on these two questions?
Yeah, so look, there's quite good tools in terms of predicting capacity. And one of the things that is very important that I didn't mention, but there's a lot of efforts going there, particularly from the WHO, and it's part of that system of response to climate change, is early warning systems. Early warning systems are absolutely essential. And we have very good predictive systems even for things like infectious disease outbreaks. The science has evolved quite a lot, and there's very, very good predictive systems. The problem that we generally see is that local meteorological services are not generally very well linked to local health systems. So oftentimes that information of how the climate is affecting health is not going from one to the other. So a lot of the focus currently is being put in ensuring that we have closer linked meteorological and health systems to ensure that meteorological services can be provided for health and that countries can implement early warning and early response systems to the impacts of climate change. So definitely a huge area of focus, but the information is not generally readily available to the communities, to frontline workers to know how to respond. And the response in general, the coordination of the response is generally what is lagging by and large still. So that is not so much about the technical capacity to predict, but how we're using those systems of prediction and of response that is generally limiting.
All right, I'd like to go to Boma Otobo. Boma, you had a question that you asked, so we're asking you to unmute. I hope connectivity is with you today. Boma, are you able to speak to us?
Yes, can you hear me?
Yes. So you said so climate change affects disease patterns, and you wanted to know from Marina Romanello what health workers can do to prepare the community for these changes. You cited in your context of Nigeria, cholera is a common disease associated with contamination of water sources. What options do health workers have in these situations? Can you introduce yourself and tell us why you're interested in the answers to these questions, and then we'll go to Marina Romanello for her thoughts on these issues. And you do have a lot of background noise. If there's anything you can do about that, that'd be appreciated.
I'm so sorry. I am actually in a noisy place. Good day to you. My name is Boma Otubo, and I work with the UNICEF as a consultant under the Big Catch-up program in Oyo State. So one of the issues that I've found is the changing disease patterns, and I know that it's also related to climate change. A lot of flooding, heavy rainfall, the drainages are all clogged up, so we have a lot of mosquitoes and so on. I know health workers can try to sensitize the communities, but sometimes they're overwhelmed because of the enormous amount of work they have to do. That's on the one side. So on the other hand, which is the other question I asked about cholera, because the water sources are also contaminated. When we do have heavy rainfalls, they don't go off. So what can we do as health workers to ensure that we help to mitigate the effects of climate changes in our communities? Thank you.
Thank you so much for that question, and two very important points. So look, you'll probably know much more about what you can do to help local communities. But what I can say is, as frontline healthcare workers, you're huge vectors of information and awareness builders. The one thing that we see quite a lot is that healthcare workers and frontline healthcare workers can be very effective in helping people understand the risks and protect themselves a lot better from those risks. You're trusted by local communities, and therefore you will be much more effective at generating the changes that you need to see from the behavioral point of view in local communities. So one thing is, for example, when you have an elderly patient or a patient that has diabetes and needs to exercise outdoors, or that is at high risk due to other underlying conditions, to make them aware that heat is not what it used to be, that they have to take care, that you have to protect yourselves from heat, and that there's good interventions that we can do at a personal level to cool down, to avoid being exposed to heat, and to avoid heat stress and heat stroke. That's kind of one thing on the heat aspect. With the mosquitoes, something very similar. There's a lot of things that we could do in terms of avoiding exposure to mosquitoes. Whenever repellent is available, then using mosquito repellent, using the nets, trying to empty any water reservoirs to avoid the propagation of mosquitoes. And obviously being very aware of those early symptoms when they do come. And with cholera, same thing. It's the contamination of water resources is a huge concern, particularly during floods and extreme rainfall events. And there's a lot that we could be doing from a personal level to avoid exposure. However, obviously, personal interventions just take you some of the way there, but there's robust interventions that need to happen at the local, at the governmental level, to put in place measures that could avoid contamination of water, to strengthen our sanitation systems, to strengthen our mosquito control systems at the local community level. And that is something that you see on the day-to-day, and that you can help raise awareness and bring the message up. So I think both in terms of community engagement and in terms of engagement with decision makers, you're there at the crucial intersection of both voices.
Thank you. Now, we have many messages piling up in the comments coming in from social media as well. I do want to go to Prakash, who says, nowadays we're seeing very frequent cyclone with heavy to very heavy rainfall in coastal areas of South India, which was not seen 3 to 5 years ago. What could be the reason? And then another question about saying nowadays, Prakash says they're seeing very non-specific strange viral fevers fevers or infections occurring in India and wonders what could be the reason. Prakash, welcome to you. I hope you are able to speak to us. Do first introduce yourself and then tell us why you shared this and what's on your mind. What's of concern to you as you've been participating in this discussion. All right, Prakash, your microphone is unmuted, but it looks like you're not able to speak to us. Unfortunately, we got at least. Marina, would you like to speak to these two concerns? So, strange viral fevers, infections, potential link to climate change. How? And then these sort of more frequent, increasing frequency of extreme weather events.
For sure. Look, there's with extreme weather events, definitely climate change is starting to make many of these extreme weather events much more extreme, more frequent, or lengthier. So there's something there that needs to be studied about why these changes are happening. It's important to say also that many extreme weather events are not due to human-caused climate change. They're just part of weather patterns. So understanding the influence of climate change needs to be done by looking at long-term trends or by studying each event and the statistical probability of them happening without human-made climate change. But it's definitely likely that climate change is influencing them. And the important thing is not only to understand that climate change is affecting it, but that our response to them needs to adjust as a result of that. That we need to be able to react differently, that events might become more extreme than they used to be, and that therefore our response needs to be a lot stronger, a lot better coordinated. And with the infectious diseases, it's something similar. Many infectious diseases, particularly those transmitted by air, by vector, by water, by food, will be sensitive to climatic conditions. So it's likely that climate change will have an influence on them. Many infectious diseases are also very sensitive to people movement, to more frequent interactions with wildlife when we have jumps from wildlife to humans, particularly for zoonotic diseases. They're also sensitive to other environmental degradation and just to the fact that we have denser populations. So we have to study them on a case-by-case basis. Not everything will be attributed to climate change, although it's very likely that the big changes that we're seeing in the climate and in the environment as a whole and in the biodiversity as a whole will have a strong influence.
So let's now go to Amrita Misra. Amrita, are you able to speak to us?
Yes. Hi. Can you hear me?
Yes, loud and clear. So don't forget to introduce yourself, and then either you may ask your question. Tell us why you're asking, also why you're interested in the answer to that question, and you may also share your experience.
Yes. Thank you so much. So I'm Dr. Amrita Misra. I work on public health in India. And why I ask this question is because I work very closely with communities, particularly women's groups in several states of India. And we would really like to introduce some models where women, communities, and particularly women can establish some kind of models of early warning systems before climatic events, such as heat waves. How can we work on this? And are there any repositories from where I can access some learnings from other countries that may have such models?
That's a really excellent question. I'm not aware of early warning systems that are put out there in a way that could be accessed by workers, healthcare workers, and used. I know that they're published. Generally, the articles are there. Generally, you have the access to the models, but not in a way. I don't think that it becomes a tool. But that's a very interesting suggestion. And I know a few people working on that. I might be wrong. They might be out there. I'm just not aware of them, to be honest. But that's a really excellent question that I might just have to come back to you on. And also a really great suggestion that's made available.
Thank you so much. I do hope you'll be able to get back on that. I'm really looking forward to that. Thank you.
All right. Our next question is going to be from Ryoka Raymond. Let's see if we can get Raymond so we can hear directly from Raymond, are you there? Are you able to speak to us? So you said your question is on the impact of climate change on mental health. And he notes, Marina, that your presentation didn't explicitly mention mental health impacts, and wonders what you may find in the Lancet Countdown. Raymond, would you like to introduce yourself? Tell us who you are, where you work, where and how you work for health, and why you're interested in specifically this issue of mental health.
Yeah, thank you very much. Can you hear me?
Yes, loud and clear.
Yes, I'm Dr. Raymond Rioka. I'm a public health specialist with an interest in environment and climate. I'm the director for Africa Climate and Health Alliance, which is a network of more than 400 NGO and health practitioners advancing climate and health in more than 38 countries in Africa, based in Uganda, eastern part of Africa. And thank you, TGR, for this forum, and thank you for the presentation. Speaking about mental health, of course, we are talking about the impact of climate change on health, and an area that is being neglected is mental health. I wanted to hear from you your status, because I wanted to hear from the Lancet if there are any talking about mental health, and how do you advise practitioners and advocates like us in the global south, especially in Africa, advancing. We were in COP29 in Azerbaijan, and we were pushing for the same. We didn't see mental health coming through. Of course, you are focusing on money, financing, and looking for the 1.3 trillion and getting that dismal figure of 300 billion. But nevertheless, how do we support, how do you guide government and health workers on addressing mental health in the face of climate change? And does the Lancet data bring out these areas? Otherwise, we have a challenge of data related to mental health and climate. Thank you very much. Over to you.
Yeah, absolutely. We do have a challenge of mental health. Absolutely. And we do have a challenge of lack of data on mental health. So the way that we approach this, and I did mention a few of the links between mental health and climate change. One of them is through heat exposure. Heat exposure, we know, affects mental health directly. We also know that the response, or at least the impact of some extreme weather events, could increase mental ill health, particularly PTSD, anxiety, and a few other disorders. We know that most of the physical health impacts will have mental health impacts as well. Impacts on livelihoods, impacts on people's jobs, we see affects mental health really acutely. And we see that sharply, particularly in agricultural workers, when it's linked to the loss of their agricultural livelihoods. The mental ill health, we see a very sharp spike in suicides when that has happened, and that's very well documented in case studies. We also know that the response to climate change could be very important for mental health in things like better cities, healthier cities, reduced stressors in urban centers, increased access to green spaces, to nature, that has been proven to have very important benefits to mental health and psychosocial well-being. One of the things that we are monitoring in the report in particular is the response of health systems in terms of early warning, early response systems. And what we are seeing is that in general, mental and psychosocial health, this is through data collected by the WHO, the response to mental and psychosocial health is the one that is lagging the most by health systems, with early warning, early response, surveillance systems being the least applied when it comes to mental and psychosocial health. So there's definitely a lot of focus that needs to increase in terms of mental and psychosocial health. The big challenge that we have with these issues is that there's a very sharp neglect of mental and psychosocial health in many health systems. Many countries, many communities, many societies still stigmatize mental and psychosocial ill health, which means that much of the impacts get hidden, they don't get reported, we don't have visibility over them. And that means that monitoring the impact of mental and psychosocial health is very difficult because we're not really exposing those impacts effectively. We're also seeing things, for example, like a lack of standardized definitions on what counts as ill mental health or mental health diseases and what doesn't. And therefore, that makes it very difficult in a quantitative term to analyze. But that said, we do have a lot of evidence, as I said, from many case studies on the huge impact of climate change on mental health. And you could argue it would warrant a whole report like the Lancet Countdown just on mental health. And we work with a lot of colleagues that are trying to advance our understanding and our quantification. It's a technical limitation, which does not mean that action should not happen, because we have enough evidence to know that mental health is at the front line of climate change, and therefore we do need to address it.
Thank you, Marina. Now, we have one last segment and just 3 minutes, which will not do it justice. And we found this quote in the latest report of the Lancet Countdown. Health workers are already intimate witnesses to the impacts of climate change on the health of the communities they serve, possessing valuable knowledge that should inform both science and policy. Can you tell us if what you heard today confirms this assertion or supports this assertion that we find in the countdown? And then really, what does the how look like? How is the legitimacy, the validity of observations, insights from health workers? How can those observations, those insights be taken on board and brought into the science of climate change and health?
Well, as I said, much of what we do is produce numbers that we validate through analytical methods. But the biggest validation of the numbers that we show has to do with the experiences on the ground and with the many voices that have come from many of you today and before this call as well. So the testimonies of frontline health workers can be hugely important to bring to life what sometimes the numbers are showing. The stories behind those numbers can be the biggest driving force for action when you humanize the numbers that we're showing. So we strongly believe that those testimonials are enormously important to gain a bit of the magnitude of the impacts. It's also, as we were just discussing, oftentimes we cannot put numbers, we cannot quantify much of what you're experiencing on the ground, including for mental health, cascading impacts that we struggle to quantify because global data sources are not available. But you have so much knowledge of what is actually happening on communities on the ground that I know that Teach to Reach has been doing a huge work of collecting, and that you have been giving your testimonials and providing with a lot of information that I hope we will find ways of making sure that that can be visible, that can be acted upon and can be used as a robust source of knowledge, which it actually is. So just to thank you so much for that work that you've done.
Thank you, Marina. One final question for you then, and I'll share here Charlotte Mbou's quote from her speech at the COP28 Health Pavilion. She said, as a health worker, she's speaking and saying, we are doing the best that we can, but we need your support. What can you say to this group here that actually is listening across in our Zoom studio, but also across social media? What is the level of, what's your sense of the willingness of the global community to support and stand up for health workers who say, I am seeing these things that are of concern to me and I want to do something about them, but I need support? What would you say, what would be your answer to that health worker and the many health workers who've expressed this to us in the context of Teach to Reach?
The global community is very diverse, and what we've seen is over the past few years, a lot of energy, a lot of focus on expanding the work on climate change and health to support local communities, to support the health of local populations as well. The Lancet Countdown is doing its share, but we're also seeing, for example, having the first COP Health Day in COP28. We saw so many health experts coming to the climate negotiations for the first time. We're seeing with the attach from the WHO a growing community on climate change and health. The WHO has made addressing climate change one of its strategic priorities. And now in the COP climate negotiations, we have a lot more focus on health that will happen also next year in Brazil. So there's definitely a lot of support and an enormous amount of work that is going to ensure that health and climate change are prioritized in international agendas, and that support can go to local communities through financial support, through logistical support, through technical support. At the Lancet Countdown, we're working to help local governments in developing these metrics, developing their own observatories, so that what's happening on the ground can be very visible to local actors, that we can tailor our information to best serve local communities. That said, there's a lot more to be done, and by no means have we managed to give climate change and health the prominence that it deserves. And I don't think we have done justice to the enormous amount of work that is going through frontline health workers and health communities that they're living this day to day, and we know how hard you work. We know the amount of pain and suffering that you have to deal with as a result. And I don't think the international community has done justice to it. Just to say, there's many of us that are your allies that are working to ensure that that happens. And there's a big community that is coming together, and hopefully we can work side by side with you a lot more, and you will feel that support. But there's many of us that are trying to support you as much as we can. And I know that with the Attach, we're working to generate that community of practice that can help accelerate action as well. So hopefully we'll see much more of this in the future. I know it has not been nearly enough.
Wonderful. Thank you so much. Well worth going over time for this special session of Teach to Reach 11, connecting with Marina Romanello from the Lancet Countdown, tracking progress on health and climate change, and including the voices, the experiences of health workers. Thank you for this time together. We wish you all well. There's one more session of Teach to Reach 11 that is coming next week, and that is the Reach Network, so peer learning for health leaders. We know there's over 4,000 local organizations, locally led organizations, community-based, some local government agencies as well, leaders participating on the 18th. So that's this coming Wednesday. That is when we'll be coming together for the Reach Network that will mark this year's final Teach to Reach session. There have been so many messages. We are going to extend a little bit just to be able to share some of the messages from this session. And a lot of it is just greetings and hellos, but there's also a lot of emotion being expressed through this session. Here we go. Just an amazing diversity here. Isha Goyal, Mutange, Marian Kaiser, who says hello back to Marian, and a lot of connections made during Teach to Reach 11 last Thursday for English speakers and last Friday for French speakers. Limasu Ferdinand from Cameroon, Hassan Ame from Nigeria. Coming in from LinkedIn, I believe Noma Sibanda. We had over 330 people. That surprised us for LinkedIn. Ruth, so many greetings. The only thing we say is, as you know, don't just say hello. Tell us what you're thinking. Tell us what's on your mind as well. All right, Kingsley says, Marina, that he likes your research indicators. Dr. Denine Hitler from Nigeria, Arnold Simoni from Tanzania, Huguette from RDC. Boma Tobo also said, this is very informative and she's glad she joined. Happy to meet this group of professionals, said Bashiru Chinade Amadou. Kingsley had questions about these different types of issues. Isa, Iya Abdul Kadir, Abdul Salam Hassan, David Ngabose from South Africa. We apologize, we simply were not able to share, and we still won't be able to share all the messages that we've received. Ismail Zinalov, if you're still watching, let us know what you made. You can share your comments. This is really the final chance to share your comments that can be shown on screen. Andrew Fanina said, lovely, nice and informative. So I think there's a lot of praise and appreciation for the presentation today. This is a hybrid format, sharing of experience, yes, but complemented with data. Maybe it's at that intersection where the most significant learning may be happening. Some of the French speakers, Eileen Mouluma, this is great discussion. Gonna have to skip ahead on some of these. Let me see. Let me start from the bottom so we can get the latest messages. Martin Ezeme from Nigeria. Sega Diakite, Douglas Mutaka Habinda said, well researched from Zambia. Marina says to us, so thank you so much, everyone, for all your work. An honor to be here, for her to be here with you today. Some exchanges, great exchanges between Teach to Reach community leaders who are here in our studio. And really, last chance. We're going to stay a few more seconds. Just if you want to say goodbye or share your appreciation, now is the time to do it. Abubakar, pharmacist, sorry, from Jigawa State, Nigeria. Andrew Fanina, Churchill Jaurès, en revenant, who says thanks and best. Gideon Johannes, Angelina Jatao. I agree with you that awareness and education will play the vital role. All right. Mario Chatsi Damiano says, thank you. It's been an insightful meeting. Thank you for listening to us and lending a hand. That's Fatima Abubakar. All right. And Haruna Al Hassan appreciates, has already downloaded the Lancet Countdown. It says beautiful textual and pictorial illustrations. Sunday, Charles Adayamo, the lectures quite expository. And thanks for making the slides available for download. Olajumoke Olufidipe says climate change has a severe effect on mental health because people that are displaced by floods will have depression. So that's it for today. Want to thank and appreciate Maria and Charlotte and the rest of the TGLF team that made this event possible. And to thank, of course, Marina Romanello, and wish you all well. We're way over time, but for good reason. Take care.